Good afternoon, everyone. This is Travis Bethel from HI Health Home. Welcome to our January office hours. I want to let everybody know we're recording this session as always, and it'll be up on our HI trainings page website in the near future. Can everybody hear me okay? Just want to do a check before we get any further.
Yep.
Great, thank you. And then the chat, can you see my good afternoon in the chat? Just make sure our chat's functioning. All right, thumbs up. Thank you, Renee. All right. So, as always, if you have questions or anything you want to comment on along the way, I know we haven't met since November. So, folks have some things they want to talk about. We can do that through the chat function or throughout today's presentation. So, we'll get started. So, first, I was going to have Karen Ashline say a few words about Health Home Admin Team. So, Karen, I didn't know if you were on and available. I think she's out there.
I'm here. Can you hear me?
Yes. Hi, Karen.
Great. Thank you. Thank you. Hi, everyone. Thanks for joining us today. Just a bit of an update. And so I think most of the, if not all of the downstream organizations are aware. Ann Hutchinson left AHI on January 14th. She went on to a different opportunity still working in the health home behavioral health world. So good for Ann. We're in the process of recruiting to fill her position. You know, she really was instrumental in building the health home program and working with all of the downstream providers. So she's sorely missed, but we've got a good transition plan in place. We're in the process of recruiting. Travis has got our information shared on the screen. You know, continue to reach out if you have any questions, and hopefully we'll have the position filled within the next couple of weeks. Again, I appreciate your patience as we work through that process.
Thank you, Karen. Yeah, so please reach out if you have any questions, especially during this transition time, and we will, as always, get back to you as soon as we can. So moving into today's agenda, we're going to touch on policy and procedure, children's HCBS waiver, some updates there. We have a health home designation review that's coming up. It's actually a redesignation, so we're going to talk about that a little bit. Some Netsmart items, some items around incident reports, core, and then the OMH mental health provider directory entry. And then lastly, we'll touch upon the health home business intelligence plan around Power BI. So that is going to be our agenda for today. So first and foremost, policy and procedure updates. I just sent within the hour 2 policy updates out to the network. They're also going to be on our HI Health Home policy and procedure page in the very near future. We have a work request in for that currently, so it should be in the coming days that they'll be up there. Those policies in particular, Jessica was going to just touch base on whatever updates came on those, and then also on the upcoming policy updates that we have in the hopper here. Jessica? I think Jessica's out there. While she's trying to get on, the Health Home Serving Children waiver and HCBS policy, that policy in particular is it's been updated to reflect how EMODs and VMODs and AT requests are going to be processed. So that's also in the EMOD policy and procedure for children HCBS waiver as well, but it's also been put into this particular HCBS policy. So that's going to be the biggest highlights on this update. Qualifying conditions was an annual review, and that has no changes currently, but we need to do our annual review of our policies. So we sent that out to the network as well, just to show that we've gone through and looked at the policy, make sure it's current. Upcoming policy updates, we've got our care transitions policy, continuity of care policy, our disenrollment policy, HARP. Now that the changes are coming forth through core, we just had a big meeting for all the CMAs that OMH put on yesterday. The HARP behavioral health HCBS policy is coming in through updates now. So we'll be updating our health home policy and getting that out to the network very shortly as that information flows. If folks didn't get a chance to get on the CMA training yesterday around core, there will be a recording of that coming out for those who attended. So I could send that out to the network as a link for a resource for folks as well once that comes. And then we have our incident reporting policy and our quality assurance and performance improvement policies coming forth for reviews and updates as well. And just a plug, again, our policy and procedure webpage has all of our up-to-date current policies and procedures that the health home maintains are present on that as a link for people to click into. So we're hoping that's a good, reliable, quick resource for you all. Anybody have any questions around policies or the policies that we just touched on quickly that were sent out today?
Travis, can you hear me?
Yes, can hear you.
Hi, I have to call in because of my WebEx issues, but it won't let me double secret unmute myself to talk.
Oh,
Yeah,
well,
so
I knew you were out there, so I figured you'd catch on once you got on. So
yes, thank you for covering policy for me. And if anyone has any questions around the updates to the children's policies, please let me know. The update to the children's policy, there's also a separate policy that also covers that has more detail. So if any questions on either of those, let me know.
thank you, Jess. Next thing, Jessica's going to touch on the HCBS waiver, children's waiver, some items that have come forth. So she's going to give you a lowdown here. Here you go, Jess.
Okay, hopefully I don't cut out. The newest thing hot off the presses is our capacity tracker. This will be live on the 31st. There is going to be a network webinar on the 26th. However, this webinar is really focused on the HCBS providers because they are the ones that are going to be entering the data into the capacity tracker. Actually a CMA, a health home, we will not be able to have access to the capacity tracker to enter any type of data. However, we will be able to view the data. This basically is going to show us in each county, by each provider, by service, what a wait list is before we send a referral. And then monthly, they are telling us that each health home will receive a detailed report of each service with each member in each county where our members sit on a wait list. So as soon as I get that, I'll probably be cleaning that up and then sending it out to each CMA. Again, the webinar on the 26th, I did send out because it will give everyone a first look at this capacity tracker, even if we're not directly entering any information into it. If you have any questions on that, please let me know. Secondly, as part of our year 2 HCBS audit, we did have a corrective action plan that we had to follow up with the state on. As part of that, we're going to be conducting comprehensive chart reviews of all of our youth that we have enrolled in HCBS. I started those this week and I'm almost done with my first CMA. I will be setting up individual meetings with each CMA to review those results. So if you don't have any youth enrolled in HCBS, I won't set up a meeting, obviously, to review those results. But I will be meeting with all of our CMAs to do an HCBS refresher training. This will be like the 4th iteration of this training that I've held. And I'm probably only going to do that in groups of 1 to 2 CMAs at a time, just because I encourage everyone as we go through that training to ask questions and interrupt me. So I want to keep it to smaller groups. So if you have any questions on any of this, reach out, and I will be reaching out to all of the CMAs personally to get those follow-ups scheduled.
Thank you, Jessica. Okay, if there's no questions or comments, we'll move on to the next topic. So as I mentioned in the agenda, we're going to be going through as a health home a redesignation review through DOH, and it may pull in partners such as OMH and the HIV Institute, et cetera, to do this review. So we are going to be the week of March 7th under review. There's going to be a look at our health home for adults and children's programs both. So it's going to be all encompassing for our 8 counties that we work with. Part of that process, we'll get a randomly selected number of charts from CMAs across the health home. We don't know what those names are going to be. Generally, it's usually just prior to the actual audit itself starting that those names are released from the state to us. I think last time was within a few days of the audit itself that had occurred. So we just want to make sure everybody's aware of that. So what we're in process of doing right now, we actually have our communications team. We have a request in to put on self-audit forms onto our HI Health Home website. And we're asking that you each use those at your organization respectively to audit your charts, to take a look at how you're doing in your respective program or programs if you have adults and children that you work with. It's going to be a section called Agency Self-Audit Forms. So it's going to be in the form section on the HI Training's website. I'll send a link to that out as well as the title of the forms once we know they're up and running. But it's going to be a annual comprehensive chart review tool for both adults and then one for children. So they're 2 separate review charts for each respective program. And then there's also a adult care manager personnel record checklist, and then a personnel record checklist for the children's program as well. So there'll be 4 links, if you will, on there that you can go to, 2 for the children's program and 2 for the adults for audit tools. So we're asking folks to utilize those tools, do your spot checks on your programs, and we'll have more information to come as we know more, as far as cases and whatnot that'll be selected. But we do ask that folks, if you have any questions, as we approach this redesignation or in general around auditing or chart auditing, to reach out to the health home email, and we'll definitely connect with you and talk through the questions or comments that you have. So that's coming. I think, Jessica, what was it, 3.5 years ago was the last review we had as a health home. So it's been a while. It's been a little bit.
Yeah, I think we're going on 4 years almost.
Almost 4 years. Yeah. So we're definitely overdue. Okay. So that's redesignation. The next thing I want to touch on was just Netsmart related stuff. One of the things we talked about a few months back, and I just wanted to bring it up again, is the importance of adding programs into Netsmart when a person is enrolled. The health home program will show up generally as a program within the programs tab. But if a person's Health Home Plus, if they're HARP enrolled, as you see in the example on the right, we want to make sure that they're entered into the programs tab. And then if if it becomes inactive, that we go in and we edit and make that program inactive, so it's no longer shown as an active program. And then you'll see the inactive programs will show as well in the chart as far as when they started and ended. So please take the time to do this. It's very important. It's something that we do track on the health home end. And we just want to make sure people are getting the respective programs in and that we can monitor that appropriately. Any questions on the programs piece or how to get to them to add them in the record?
Hi, Travis. It's Jessica Casey.
Hi.
I just have a quick question. So we noticed that, if we have a patient that has, or a member that has, let's say HARP eligible for a program when we first initially put them in outreach or enroll them. And then when they transition, if they become HARP enrolled, that doesn't change automatically because there's no connection to MAP after that. But we noticed in MAP that they're HARP enrolled. Is it appropriate for us to be closing that HARP eligible program and adding that HARP enrolled program, or vice versa when this happens? Because we've been doing that. So I just want to make sure that we're supposed to be doing.
If MAP is showing that the person is changed to enrolled, once you've gone through the process, I would definitely change that in the system
Okay.
to reflect the accuracy of what MAP is showing. If there's questions, if you're concerned about the alternate where, I don't know if this is actually valid or not, I would reach out as well. so we can look into it on our end to make sure that the person's appropriately active in the programs that they are in. Is that helpful?
Yes, thank you.
Okay. Any other questions on programs? Adding, well, not removing, making them inactive? Okay.
Travis?
Yes.
Hi, it's Rick with Catholic Charities.
Hi, Rick.
How you doing? So in another system for another health home, the HARP, I guess eligibility to the HARP status is updated through the upload download that's done with MAP. Do you know if that's possible with AHI's Netsmart?
I'd have to defer to Courtney or Taylor on that one because they're in the download upload piece more frequently.
Right. Travis, it's Jessica. I
Oh,
can
hi,
I can
Jessica.
take this. Hi. I know how much Courtney loves to talk. Yes, so Rick, you are correct. Our Netsmart is formatted with MAP to do that. So once a member is sent from MAP into Netsmart, that upload does occur and that program is assigned. However, it only happens with the initial feed from MAP to Netsmart. So like Jessica Casey brought up, a person could come in as an H9, which means they're eligible. But when they change their status to HARP enrolled, MAP wouldn't then refeed that program. You would have to go in and manually update it.
Thank you for that feedback.
You're welcome.
Yeah, it's good to know that.
All right, great. Thank you, Jessica. Any other questions on programs? Okay. Next is around HML. I wanted to just touch base on question 11 for the high, medium, low assessment that's done monthly for billing for enrolled members. We've been getting a lot. I sent this out to the network, I don't know, about 3-4 weeks ago as well. A lot of scenarios have come back as billing has been processed that have shown that Adult Home Plus was entered as a yes. It should always be a no. That's not a population that we would work with in our health home in the North Country. So I just want to point that out. I know we always have staff changes and things change a lot in our health home program in general. So I did provide the link to the actual billing at the right rate, how to complete the HML and CBQ, the Children's Billing Questionnaire that we had conducted about a year or so ago. But that link is on our HI Trainings webpage, which is right here as well. So if there's any questions, always feel free to reach out as we always offer through the health home email. But check that link as well. It's a nice refresher in the sense that there's screenshots such as this of the actual question. If there's drop downs, how you answer it, how it changes a person's billing rate, how long it can change that acuity rate for billing, et cetera. So we just wanted to point that out. I think it can be very confusing. Adult Home Plus sounds very similar to Health Home Plus. So we just wanted to make sure that we pointed out the difference for this particular question. Anybody have any questions or thoughts around this particular item? Okay. The next thing is Netsmart reports. So Netsmart is working on doing an update to the reporting server itself within the system. They're looking to do this update at some point during Q2 of 2022. They're asking at this point for any organizations that have reports that they're running through the self-service report function to put them forward if you have interest to continue to do those reports as you're working in the system. So we're asking if folks have certain reports that they're working on, they have currently, to forward the title of the report in an email to Taylor Dawson. She's working with Netsmart on this particular transition for the self-service tab. And, all reports may not be carried over. There may be more of a generalized theme if there's consistent themes that are coming up across organizations. But in essence, so they'd like to see what types of requests are coming through to try to accommodate. If people don't know Taylor's email, tdawson@ahihealth.org. You can also send it to the health home email, and we can be sure to get you connected with Taylor. I saw a hand raised. I think it was Renee.
Yeah, it's me.
Hi, Renee.
Hey, Travis. So, for everybody, this is Renee with Alliance for Positive Health. My team is probably laughing in the background. They're like, oh, they're talking about reports, and Renee raised her hand. But anyway, so I just want to clarify, because I have built, and thanks on a secondary to Jessica Casey for teaching me all that I know about building reports. But anyway, I have built many reports. So I just want to confirm that this is both reports that are in self-service and self-service version 2. That, like, will this new report system sort of watch both of those? Or I'm just trying to make sure that I'm pretty sure that Netsmart isn't going to want to incorporate all like 15, 16 to 20 reports that I've built. So I just
Right. Great
any more
question.
clarification.
Great question. So Taylor, do you mind taking that? 'Cause I know Taylor's been in direct contact with the project manager at Netsmart on this, and she could possibly touch a little bit more in depth on how deep this is going to go and the logistics at this point around it. Taylor, are you out there?
Yep. Can you hear me?
Yep. Thank you.
Yep. So we don't have all those details yet. Basically, all they've told me is that they're going to be switching over the platform. So from what I can understand, anything that's been created will not be transferred over unless it's chosen as one of the reports that it kind of falls under the general umbrella of things that they're receiving from other health homes and other organizations that are going to kind of meet the needs of everybody in the network. So they've offered to do some of that building on the back end for those reports that are, that the health homes and the care management agencies are really looking for. But I can tell you that she said that it will be a much more user-friendly platform for creating reports, if that makes anybody feel any better.
Well, no, that you already just answered my next question. And because as long as not that I want to have to rebuild all the reports that I built and
Of course not.
no pun intended, tailored over the course of the years, but as long as there's the ability to rebuild a report that may not have been chosen to proceed to the new version. So thank you,
Yep,
Taylor.
absolutely.
Yep. And Shelley, you had a question in the chat. Did this help answer that question? So there's more to come. Yes. Okay. And the other thing I wanted to throw out there, the health home in the past as well, and the data team has always looked to try to incorporate reports for the network. You could always put something forward as we're going through this transition with Netsmart. And if it's something we can do on the health home end, we could take a look at that. So, I just wanted to throw that back out there as well. I know there's always moving parts on things, but if we can support in any way, we will do that.
Hey, Travis, it's Jessica Casey again. We just get some just reminders as the time starts creeping up, because I have lots of reports in there that I've built, and I know I've got to clean up some. I've got some that that are irrelevant at this time. So I could definitely do some cleaning up over the next few months, but I'm definitely going to want to screenshot some of the reports that I want to keep and that may not make the cut into the new update.
Absolutely. Yeah. As we know more, we'll definitely share that information with the network. The interesting thing is this just came up just recently with Netsmart, and they're originally saying first quarter, and then that changed just the other day. So we're breathing a little bit. It's like quarter one. Wow. We're already pushing toward the end of January. What's going on? And then they came back and said quarter two. So that's good in that respect. We'll definitely keep people up to date as we know more information. This is more of a, throw it out there right now, just so you know it's coming down the pike, and we'll keep you posted. Any other questions around the reports? What's to come? Okay. Incident reporting. So we had a couple questions come through recently around COVID-related deaths. There's been unfortunately more of that occurring. So just a reminder that DOH is requesting that any COVID-related deaths have an incident report completed and submitted through the IRM. So they are tracking that information. So we just want to make sure people are aware of that. And then just also too, that each organization should have a staff identified to have access to the IRM system and to be able to submit to the IRM system any instant reports from their particular health home program. We are working on an AHI IRM template, which basically, I'll show you on the next slide, what the state IRM's template is. So we're going to have that. We're just going through final reviews right now. We're going to get that out to the network as a tool so that people have that as consistency when they're filling out the report. But we want to make sure that people also remember that these reports have to be submitted within 24 hours of becoming aware of the incident. So, that hasn't occurred much where we've had issues with that, but there have been some instances where that 24 has come and gone. And, it does get questioned if we go over that time frame. So this is the template that we're looking at. Hopefully people can see it to some extent. Again, we'll get that out. It's going under policy review right now. It'll also be an attachment as to our incident reporting policy as that gets updated and sent out. But we're hoping that this will help people as far as have a fillable form. We're trying to set it up where you can toggle and click, make it easy for people to get through it as much as possible, and so that they can get those things submitted. Any questions or any comments around the template or around incident reporting in general that anybody had?
Hi, Travis, it's Taylor. I just wanted to provide a little bit of clarity. So this form will be primarily used by any care managers within the organization to then send to your supervisors to submit into IRAMs. So I know a lot of the care managers were using the old DOH incident form to send to their supervisors for their supervisors to then input the information into IRAMs. That form didn't encompass all of the questions that IRAMs asks. So this new template just kind of lays out kind of verbatim all of the questions that IRAMs asked, just to make it a little bit easier for the supervisors, not having to go dig in charts for last contact date and things like that. So hopefully it'll alleviate a little bit of work on the IRAMs reporter side.
Thanks, Taylor, for the additional info. Yeah, we're trying to make life easier. So that's the intent. So hopefully it's a useful tool for folks when they get it distributed out to the masses here. So that policy, that template should be coming out in the very near future for folks. So, again, it's going through final reviews right now. So stay tuned. It's coming. But that 24-hour time frame, that's important just to keep that in mind. Once you become aware of the incident, I should add to that, that we've got that reported within 24 hours. Okay, thank you. So we'll move on to the next topic, CORE. So February 1st, let's go time for CORE. I put the links up again to the MCTAC training page. It's been all the different types of trainings that have come through in the last couple months. Yesterday was the CMA, what CMAs need to know. There's going to be a recording from that training, which once I get a hold of that, it's supposed to come out in the next couple of days. I'll send that to everybody that's on the distribution list, and please share that with your teams as appropriate. I've also got the link to the OMH Core overview website, so it's just going through all the different FAQs. I'll also send out the FAQ actually when I send out the link to the what CMAs need to know recording, just frequently asked questions that people have had around CORE and the implementation. But the big thing I wanted people to be aware of is on February 1st, these 4 services that fell under the behavioral health HBS services are pulling out, and they're going to become CORE services. So the community psychiatric support treatment is going to be a CORE service. Psychosocial rehab will be a CORE. Empowerment service for peer support and family support and training. So they will become CORE services. This, from my understanding, is supposed to happen through the magic of people who are core providers. So there's nothing we're supposed to do on our end as a provider, if you will, to paperwork or changes along those lines. But these 4 services will come into the core umbrella. Other changes, and I figured I'd just pull the slide directly from the DOH website through the training they held the other day. These services here are going to continue as behavioral health HCBS services. And the importance behind that is because behavioral health, home and community-based services will still be an available service for folks that are enrolled in that service. So these services will remain intact. That means that as people become eligible for HARP and they enroll, if they have an interest in HCBS, they can do the New York State eligibility assessment, the HARP assessment, if you will, which is actually the New York State eligibility assessment in the HCS system, to get that person to see whether or not they're eligible for behavioral health, home and community-based services. And that person can make a choice at that point if they want HCBS, or they can also transition to core, or they can do both. They can be eligible for both, as well as what we're being told. So we'll type more information on that through the policies as we get that coming through from DOH. Any questions to this point before I go on to the next slide for what else is going to be a big change? Okay.
Travis, this is Lori Bishop.
Hi, Lori.
Years ago, we scheduled some presentations from some local providers. Again, I don't do a lot of this directly myself, so I'm not sure what the feedback is as far as accessibility and the realities of, how this is truly working. Yesterday with the core training, I was able to find the core providers for Warren, Washington County. I couldn't find one for the HCBS as far as an updated list. And then at some point, can we get kind of a snapshot from those providers? Can we schedule something where they're talking about, what they're doing?
I would love to do that. I think that's a great idea. And once we get a good grip on who they are, who are those core service providers as they start moving forward, because that wasn't very clear from what I heard yesterday either. So yes, I think, I definitely would advocate for that once we get that information. That's a great point, Lori. Anything else around?
A lot of them that I saw historically were children's providers. So I wondered as far as the adult world, how that would cross over, but.
Right. Okay. No, that's a great question. That's a good thing for us to look into. So moving on to the next big changes for this. So people so now somebody enrolls in, they're HARP eligible, they enroll in HARP, that workflow stays. That's not changing. But when you get to the HARP assessment, which is the New York State eligibility assessment, that's the assessment that sees whether or not the person's eligible for home and community-based services for behavioral health. Only those members as of February 1st who are interested that have enrolled in HARP to do the New York State eligibility assessment will have to have that assessment done. We don't have to do it for everybody like we do now prior to 2/1. So it's only going to be for those folks who are interested in the behavioral health, home and community-based services avenue. The other thing is if somebody is HARP eligible, they're enrolled, they're currently behavioral health, home and community-based enrolled, they've been approved for those services, they're in that service, we got to do that reassessment annually at least moving forward. So that's still going to be the case for those people that are actively receiving the home and community-based services as of 2/1. If they're actively receiving that service, got to do that assessment at least annually to look at the eligibility still. If they're not interested in the service, they haven't enrolled in it, you don't have to do the assessment as of 2/1 if they don't want to do it. The other thing that's a big change is there was a 90-day time frame to complete that, 30 to 90 days max. That's no longer. So that New York State eligibility assessment does not have a time cap to it at this point. So that's a big change. And then the other big change was there was a mandated face-to-face requirement to administer the eligibility assessment now you can also do it through telehealth as well. So that opens up some leeway for folks. OMH, I just put the BML link here just so folks would have that. If there was questions, they definitely want people to go to that. Those are the big things that are coming through as of 2/1. The HARP eligibility, the codes, the H codes, that's not changing. I haven't seen anything as far as billing, how that's not going to change. All that stuff's going to stay in the same workflow that it was in. It's just coming down to core is now going to break out into those 4 separate services from behavioral health, home community-based services. So hopefully that just gives you a little. Yes.
Oh, my apologies. I just have it. This is Renee again. I just have a question. Maybe it's a clarification. I know that, I mean, I don't want to speak for everyone, but I do know that when we started walking into this transition, there were a lot of promises that this would make things easier for the health home case managers. And it doesn't really feel like that's actually how it's working out, because the bulk of the services, and I'm getting to a question, but the bulk of the services that someone who's HARP eligible can receive still remain in the HCBS arena. That, there's only a small part that have fallen into core. And I guess I guess this maybe is just like a bigger discussion or a question. I'm still seeing that we are probably going to have to do the eligibility assessment on more than 75% of our population, because they, you know what I mean? If they want peer services, then that's HCBS. But if they want, so then
Right.
but if they want, PSR, then that's core. If they want both of them, then we have to do the assessment. And then how does that impact the care plan in terms of the actual HARP care plan? Are we only doing the care plan for the HCBS services, or if they're also getting, you know what I
Yes.
mean? So it sort of
Yep.
made it more complicated.
From what I heard yesterday, the care plan would be specific to those enrolled in behavioral health HCBS. So if somebody wants core, that duration, frequency, and scope of service is going to be something that the core provider designates through their plan that they're working with the person. It's not something that we would have to put in a plan of care as a separate thing, like we would have to for the persons enrolled in behavioral health HCBS. So there's a difference there where it's supposed to be simpler for core folks. The other thing with core folks is they can get a referral from a lot of different entities, so it's not just mandated to one source. And then the other piece of it is that the licensed practitioner of healthcare is signing off, basically saying that justifies the need, that this person is justified in the need for the core service. And then it's connecting with a provider. So there's not all the level of service determination type stuff that you're doing with the behavioral health HCBS folks. That's not tied to the core piece, as I understand it at this point. I still have to dig through some of the final policy stuff that's coming through before we roll that into ours. But my understanding, based on what I heard yesterday and just stuff that's come through in the last few weeks, the core workflow is nothing like the behavioral health HCBS workflow if a person is interested and eligible. So over time,
I'm fascinated by the whole. Yeah, I'd love to know the logic behind why it happened this way. My concern, and I guess maybe I'm being, it's just that we all know that health home case managers are very, very busy, if not perpetually overwhelmed. That I just don't want it to happen that our H1 individuals will be prioritized for core, not HCBS, because the HCBS will make more work for the case managers, right? You know what I mean?
Right.
So,
I think, well, I don't want to speak for the state, but the way I'm envisioning this is as time rolls on, more people will naturally roll to the core service. The HCBS will probably start to go back as far as, numbers of people enrolled, et cetera. It sounds as though they're stuck with the 1950C waiver requirements for the behavioral health HCBS, and core falls under a little different category as far as how it's regulated. So there's not as strict guidelines that have to be in place, at least at this part in the process. But I'm hearing you. I mean, it's a person.
Gotcha. No, and I don't. We're all on the same team here, so I just was curious. Yeah.
Yeah, because you could have somebody saying, well, I want HCBS and I want core both. So now you've got, you're doing both workflows. But we'll be sure to get more information as it comes here. Those policies are starting to tighten up stateside coming through. So we'll get ours tightened up and get it out. But we didn't want to send it prematurely either, because we don't want to, keep going back and forth and making changes and getting people more confused than they may already be from the changes that are coming. But hopefully this will provide a little clarity on some of the bigger points that are going to happen as of 2/1. And we'll get more detail out as we get that tightened up. Mary, I see that you've got a question on the slide deck from yesterday. They said that they were going to send it out along with the recording. So once that comes, I can tie that in as well, the webinar slide deck. So I'll send that out to the network as well. Gotta write it down so I don't forget my notes here.
Travis?
Yes.
I just want to add, I know it's a very small population of our CMAs that serve children and adults, but this new core workflow is very similar to the new HCBS and CFTSS workflow on the children's side, where you could have a member want to receive one set of services and not the other, or both. And then really what this will do is that if a member wants to receive a service that comes under core, it takes out the whole assessment piece. All you're going to need to do is get a medical necessity form signed by an LPHA and then make the referral. And then after that, you just follow up on the referral like if you were to make a referral to any other spa service. On the HCBS side, if they want to go with an HCBS service, that is where the assessment piece comes in to make sure that they're eligible. You got to get that level of care. And then you would need to do that, that HCBS specific plan of care. So it seems a bit complicated, and it is complicated because I'm not going to say that the children's side is not, but once you kind of see the workflow of it, you can kind of see that the most popular core services are going to be a pretty simple referral process, assuming that all of the current providers can easily, pick up these referrals, and we don't struggle with wait lists like we do on the children's side, but it will be an easier, more streamlined referral. And the reason that they could not do some of these services because there were CMS guidelines that made it impossible for all of those HCBS services to convert to core. So this was their way of giving us some flexibility, but not being able to give us everything.
Thanks for that addition, Jeff.
Hey, Jessica, it's Lori. Just wanted to clarify that technically with the core, from what I heard, and maybe I heard it wrong, they don't even have to do that LPH form, assessment form initially. They can actually make the referral, and the core provider may have someone that can complete it there. So
yeah, and technically for spa services on the children's side, that's also true. However, every provider requests that form. So we'll see how it plays out if the adult providers are as stringent as the children's providers. And like you mentioned, we have some historically children's providers providing some adult services now. So we'll see how that plays out, but that is happening.
yeah. Not like they had a lot of room to begin with, did they?
The other thing I just wanted to mention too, there have been some questions that have come through the health home recently, and it's a good question. Do you have to do the HARP assessment still as of 2/1? So I just want to clarify, when we say HARP assessment, that's really the New York State eligibility assessment. So if a person is interested in the behavioral health, home and community-based services waiver, that's when the New York State eligibility assessment, the HARP assessment, quote unquote, needs to be completed, or if they're enrolled in that waiver and they're due up for that eligibility review again, it needs to be completed, within the year. So a HARP assessment is not separate from the New York State eligibility assessment, is what my point is. So I just want to clarify that, because I think that language gets lost as time goes on and people are doing certain processes and things. And then, people come and go and others come in and it starts to muddy the waters a little bit. So anything else around core implementation? I know it's coming quick. It's one of those things.
I
Hurry
put a
up and wait.
question up.
Yes.
Sorry. It's Lori again. So I put a question up, and I guess I've kind of thought about this the whole time through COVID and telehealth. So as a health home, we've been able to bill services via phone contact, right? So
Yeah.
they're saying that the eligibility assessment can now be completed through telehealth. However, their classification of telehealth isn't necessarily a phone call. Is that not a video chat kind of call where it's, so I just want clarity on that, so that, again, I always wonder when people talk about telehealth and where we're at. I've never really walked that slope per se, because we've been maintaining sort of the old fashioned and then doing phone.
Yeah.
So is there clarity or specifics so that we understand how that applies to us?
Have to do a little more research on the specific to the changes for 2.1 for this particular topic. They may be strict to, like, a certified telehealth platform that's, going to have video and it's secured and it's meeting security standards. So I'm going to have to dig more on that, Lori. It's a good question. I don't have more clarity on that at the moment, unfortunately. Jessica, do you have anything further?
No, but I'm assuming, and you know what they say about assuming things, but if they are saying telehealth, then I believe what they're referring to is a certified telehealth
Yeah.
platform and not a telephonic contact.
That's my hunch as well. That's why I just want to dig on it, though, Lori. It's a good question, because we don't want people just making phone calls if that's not what the intent is through this policy change, particularly.
Right.
Yeah. Oh, good
Thank you.
catch. Yep. So we'll follow up on that for the network once we get that answer. Any other questions around this topic? Okay. The mental health provider directory for those CMAs that were designated to provide Health Home Plus services to adults. Just want to remind folks, you would have gotten information about a month and a half ago, roughly now, that you have to enter your organization in the mental health provider directory by February, 11th, I believe is the date. So I just want to make sure people are aware that it is an organizational thing that you have to do. Your security manager, whoever's deemed that person for your organization, has to have access to be able to give whomever's defined to give access for the MPHD to get into the system to enter your organization's information as a approved provider for this service. Thought it was interesting that OMH asked organizations to enter this when they already have the information, but that's the process that they've required. And again, the OMH website that they're asking information to go to for questions is here on the slide. I had to enter it for our internal CMA at AHI. It wasn't too bad. I mean, it took a few minutes. I got an email confirming that I did successfully send it through the right way. On a couple of them, I got a kickback because I put the date that I got the email from OMH saying that we were designated, but it in fact goes off from the date of the letter that you're designated from OMH. So I went back and made that correction, resubmitted, got another note back from OMH saying we received your submission. And then it was within I'd say a day and a half, I started to get the response back of approval. So it was an approval email that it was successfully received and entered appropriately, and that they approved that entry. So it wasn't too bad, and the system checked you along the way. There were certain asterisks that have to be filled out in order to proceed. But February 11th is that date that's approaching. I mean, we're pushing into the final week of January here, so just wanted to remind folks of this. Anybody have an issue getting this completed? Has there been any concerns for those that have been designated? Okay. Well, let us know if you do run an issue, if there's anything we can try and help walk through. But we just want to make sure that you get that in there within the time frame.
Travis, was the letter attached to the email? Because I feel like it wasn't attached to my email.
The letter, I'm trying to remember if it came through email when I think it did come through email as a separate email once OMH formally sent the letter. I'll look back at it though, Lori. So I don't remember just having it come through the mail. I think it was through the email.
Yeah, I could only find an email, so that's the date I gave to Kim, who's probably like, great, now I need the date on the letter. I'm not sure where the letter is. All right.
Oh, there's nothing to be sorry about. I went by the date of the email initially. So it just seemed natural. All right, so data then. We are still working to continue to work on the Power BI platform. There were some contract discussions that we were having with the organization that's helping us to pull that data in, get it set. So we're in the throes of finalizing those discussions. We are going to be moving forward with the DataDen Power BI platform. So there's going to be more information to come on that. I know there's a couple of organizations that have been testing that we started to do a soft rollout with in the fall. That did stall a little bit because of some of these contract discussions that we've been having for the continuation. But we're looking to start moving forward again on it. So I just didn't want people to think that this, we brought it up in the summer. It was this great thing we were going to do as a network, and then it just fell off. We just had to slow down a little bit and just go through a few things and look at the contract again that we are putting together on our end. And our intent is that this is going to be a tool for the network, not only for quick reports as you get going, because there's going to be constant updates to the system when it's up and running, but there's also going to be an ability for you to do, self audits quickly for running reports through this platform. So there's an intention that it's going to be a tool that's going to be multifaceted for you as an organization for your health home program. So we're really excited about it. It just isn't quite there yet, but we're going to keep trudging forward on it. So that's the DataDen update at the moment. So we'll give you more info as we move forward. Any questions about that? I know a lot of people are just waiting and probably got off your radar at this point, I'm sure. But just want to bring it back into the purview a little bit. And then that was all I had today, or we had as a group. I don't know if anybody had any other questions or anything else they wanted to talk about. Hope everybody's staying warm out there and safe.
Hey, Travis. Hey, guess what? It's Renee again. I just have a question/request, and I feel like we've maybe as a group talked about this before, but it's something that's come up before. But anyway, regardless, is there a way that we can ask Netsmart to, because obviously AHI has carefully built their own comprehensive assessment into Netsmart, right? So that it doesn't have, all these sub-assessments, which is fantastic. But the weakness of this is just that we can't print off a PDF of that whole completed assessment. We have to do it per section. Is this making any sense?
Yeah, yep, I totally know what you're talking about.
Is there a workaround that I'm not aware of, or is that
Yes,
something? That's,
we have a Word version of the assessment.
yeah, of the blank assessment. What we're talking about is
Yes.
that once we complete one, because to give a better example, so all of us have probably had a lot of turnover in the course of the last year or two for lots of reasons. But so a new case manager takes a caseload. Obviously, it's going to be their first time doing this comprehensive assessment with this client. 90% of the time, while there is digital capacity to do signatures and stuff in the field, we just don't have like the bandwidth, meaning literal bandwidth, like internet and like cell service to be able to do that. So it would be helpful for the case manager to be able to print off the last completed assessment and bring that with them, right? But I mean, we can, but we have to go into each of the dozen or more sections and print them off separately. So I just don't know if there's a way that we could, if that's an ask.
So
Go ahead, Jess.
we can, oh yeah, I was just gonna say, they are, last I heard, and Taylor could have more insight to this, they were actually moving where our comprehensive assessment was housed, or they were moving assessments around. And it was brought up, I want to say months ago, that they were going to move around either the assessment tabs or where the comprehensive assessment was. Either way, they were moving something. Maybe with that move, we could have them have the capability to print this off as a PDF like they would the plan of care.
Right.
We can ask, but I can't promise on anything.
No, and I would never expect a promise. It's definitely like an ask is the best that we can do. But yeah, because I mean, even with the old assessment before we all moved to like, it's not proprietary, but lack of a better word coming to my head, you still had to go to documents and you had to like it wasn't like a download, but you had to create the assessment and then you printed it from there. Even if it was there, those couple extra steps, it's still way better than PDFing like 17 sections.
Yeah. That's
Yeah.
daunting. That's a lot of screenshots. A lot of,
Yeah.
I'll put that in with my ask for the expand all button on notes.
Oh,
Because that really
That's on
grinds
the
my
list to
gears.
ask
bless
Netsmart.
your heart, people. Oh my gosh. Yes, that would make QA so much easier. Although you can build a report that is now going to get washed with this new update, but picking and choosing. But thank you very much.
Yeah, no problem. So we had a chat question. If we could ask about individual questions on the comp assessment. Sure. What's the question?
Hello, I have a question about where it asks about alcohol consumption. It doesn't allow care managers to put in 0 or none or actively sober. It's a mandatory question and you have to hit 1 or 2 as the lowest amount. And I was wondering if there was an ability to put either doesn't drink, actively sober, in recovery, or 0, something to that.
We can definitely bring that back and see if that's a potential.
So I can take that.
You got that, Jessica? All right.
Yeah, unfortunately, that is not a possibility because that assessment is a standardized assessment and you can't change the responses on it. We would have to completely change the embedded assessment in the comprehensive assessment under the SUD tab and go with a different assessment. But yes, you would just pick the lowest one because it is a standardized assessment. We cannot change any of the responses to that assessment. It's not a great answer, and I understand that, but it's one of those things that maybe one day we'll update that mini embedded assessment too.
Right. We can definitely put it on the list. To have.
It's on the list.
Yeah.
We got a big list.
And you're correct, Lori. It's not client-centered. You're right.
It is not.
Okay, no, these are great questions. We appreciate them. We will add it to the list and we will bring it up as things come up that we can get changed in the system. Yes. Teresa just sent a chat as well. When somebody doesn't drink at all, it's a misrepresentation. Yes. Anything else anybody wanted to bring up or mention? Questions? As always, we really appreciate everything you do and thank you for your time today. I will get the slide deck out to you shortly and the recording will be posted within the coming days on our website. And I'll also get out to the network the recording of what CMAs need to know webinar that OMH put on yesterday, as well as the slide deck that goes with that and the frequently asked questions that are going along with core. So that'll come out as soon as I get that from OMH. I will forward that to the group so that you have that information. And there'll be more to come on the HARP policy itself as we start to define that better in the coming days. But any questions in the interim, please reach out as always. And thank you all for your time today. Have a good one.